My 10-year-old gelding loves to goof off with his buddies and is a bit on the accident-prone side, so he always seems to come in from the paddock with a new nick, bite, or scrape. Although I don't treat every little injury, which is wise, I have used everything from hey, where's that blue stuff, to Vetricin spray, to Furazone, to triple antibiotic cream on some of the bigger ones. Honestly, whatever I happen to have lying around most of the time. I understand that. Most of the time I'm concerned with keeping the wound moist so it can heal naturally without scarring and keep the bugs and dirt out. However, I never really know what I should be using or if it even helps. What is your favorite product or recommendation for how to treat these minor injuries? When is it appropriate to use antibiotic cream versus a spray? Are there any products I should avoid? Charlie and I thank you in advance.
Charlie.
Poor Charlie.
This doesn't sound like a controversial topic, yet it is.
Ooh.
It is.
I like it.
Oh, boy. So this is an area where horse owners, I mean, you've been in a lot of barns. There are as many products for wound care as like stars in the sky. So what that means is that nothing really works great then, right? And everybody has their favorite, and I'm not going to diss anything.
Ooh, you're not going to put on a shirt that says I'm team...
Man.
No?
I might, something might pop out of my mouth. I'm going to try really hard.
Okay.
The biggest thing is we don't want to interfere with the horse's own healing. And unfortunately, many of the products found in barns do just that. However, horse people, I think people like to do something. You know, you feel like you need to do something. I'm the laziest horse owner ever because I see a wound and I'm like, it's a long way from his heart, and I carry on. It really, you have to clean it, because one of the sayings we have is dilution is the solution to pollution.
Oh, you vets, you poets.
That's and that just means clean it. Now, there's tons of things to clean wounds. You know, you really need to clean a wound.
Oh, I bet it's water.
It's water. It's water. You can use saline if you want. If you really want to feel like
fancy water.
Fancy water. This is what I like. It's a betadine solution, so it's iodine. If you mix this in water or saline to a dilution of weak tea, that's an excellent potion to clean out a wound.
I will also say, if you're a person who likes to feel like you're doing something, betadine feels very medical.
It stains.
It does. It stains, and it looks a little bit terrible. Like it smells terrible. It looks a little bit like a surgery table, and you feel like I'm really doing it.
Yeah.
So.
But be careful and don't use it full strength. And you only need to really do it once. Don't clean every day with this. Be gentle, because if you overdo it with this or like hydrogen peroxide, there's one. I'll say don't use hydrogen peroxide.
Well, not unless you want to get kicked in the head.
Not good. You're going to kill cells.
Wow, I did not know that.
Yeah, and you don't want to kill cells.
No.
Because there's a couple stages of wound healing, and inflammation is necessary. Inflammation is not a bad word. And then there's the debridement phase where dead things and bacteria and hair, all that needs to leave so it can have a clean surface to then epithelialize, granulate in from the bottom up or top down, and then make skin and then mature. And so vets who are in wound care, that discipline, they're like, okay, cleaning it's fine. If you want to use, we have a couple hydrogels. This is one by Prime. Vetricin makes one. I think it's this one. Yeah, hydrogels would be good for the first couple days, 3, 4, 5 days, because they're water-based and they allow the cells that do the cleanup work to move around in there. Is that awesome? But then stop. You don't need them. Let the wound heal on its own. Once it begins to cover skin, make new skin, and some sort of emollient, some sort of ointment that keeps things moist, like she says, is not a bad idea. But not all emollients, ointments are created the same.
Okay.
You know, some actually slow down, delay healing, and that's not what you want. So the articles that I read and the talks that I've gone to, I try to go to a wound care talk at every vet conference I attend. Not that there's new information. it's not that there's new information, but that I need, because I'm even tempted. Like, ooh, pretty products. Well,
Right?
I'm even tempted.
Well, we get such a great discount.
I know,
It's worth
I know.
trying something.
Nope, water. And then, do you know what the number one ointment vets are still saying? Experts in wound care are saying to put on wounds that will help healing and not delay.
Ooh. If I had guessed, I would guess something for people.
Yeah?
It's Neosporin?
Yeah!
Yes! Ooh.
A triple antibiotic is still the best thing. And one other saying, this doesn't rhyme as well. I don't think I can make it rhyme, but don't put anything on an open wound that you wouldn't put in your eye. That doesn't rhyme.
No.
It's a little catchy. So, but the point is, don't go overboard with wound treatment. Don't get excited. Everybody stay calm. Talk to your vet, and she'll tell you when it needs to be sewed and when it's just an abrasion, like not a full thickness. You can handle it, or it needs sutured, or it needed sutured 2 days ago. You blew it. Work with your vet. They'll help you. The location of it, like some wounds that don't look like a big deal, but they're over a joint. Those end up being a big deal.
Yeah.
And then other wounds, horses have a remarkable ability to heal. Let them do it.
Okay. I like it.
All right.
Charlie, I hope you like it too.